I'm Sarah. Welcome to the Hospo Health program. It's important to recognise that there isn't just one single reason or cause for the higher rates of alcohol and drug misuse observed across the hospitality workforce. Instead, there's a complex mix of work-related, social and individual level factors at play that can heighten the risk for alcohol and drug misuse and associated harm among hospitality workers. Let's first of all consider some of the work-related factors. Generally speaking, we know that the working environment, regardless of industry, is a really important determinant of the physical, psychological and social well-being of workers. And working in hospitality can offer a range of exciting and unique career and social opportunities, including travel, flexible hours, and pathways that allow for job variety and career development. However, in some workplaces, it can also involve working conditions that can place a person at greater risk for alcohol and drug misuse and associated harms. This includes working long and irregular hours and shift work, which not only take a toll on the individual worker, but also on their family and social life. Working in hospitality can also involve working in physically and psychologically demanding environments, which often are described as fast-paced pressure cooker environments, which require workers to work under stress for prolonged periods of time. Cannabis use is commonly reported by hospitality workers as a way of coping with this fast-paced pressure inherent to the industry. Similarly, a few knockoff drinks or using drugs is described as commonplace as a way of relieving tension after a stressful shift or building a sense of camaraderie with co-workers. Hospitality workers often describe having to navigate working environments where high levels of verbal abuse and aggressive and bullying behaviours, either from other co-workers or patrons, is not only commonplace but also condoned. Sexual harassment and sexism is also frequently reported by female hospitality workers, especially younger female workers. Sometimes, unfortunately, these behaviours may be viewed as acceptable or explained away as just part of the job. For example, in kitchen environments, verbal abuse and bullying from head chefs may be viewed as acceptable for ensuring compliance and submission within the kitchen hierarchy. Similarly, workplace cultures that adhere to a no tattletales culture or discourage speaking up mean that workers, and especially younger workers, often feel alone and powerless in managing these stressful and unethical behaviours. And as a result, they can often turn to unhealthy strategies to help them cope, including normalising these behaviours and engaging in alcohol and drug misuse. There are also a range of workplace social influences and norms that contribute to the higher levels of alcohol and drug misuse seen across the hospitality industry. A recent Australian study highlighted the heavy drinking social culture that exists within the industry and found that this is particularly pronounced among male workers, who tend to adhere more to heavy drinking cultural norms and attitudes that drinking and drug use is a way to connect with colleagues and express masculinity. We also know that trainees and younger workers are heavily influenced by workplace cultures and social norms around drinking and drug use. In fact, younger hospitality workers often describe feeling pressure to participate in work drinks and drug use in order to fit in and be accepted by their workmates. And this is even more challenging for younger workers who might be living and working away from their usual support networks of family and friends. Alcohol and drugs are also reported by hospitality workers as being readily available and accessible across the industry. Research has shown that in some workplaces, on-the-job drinking is actually encouraged through access to free drinks, and it's seen as a way of loosening up and creating an enjoyable environment for both patrons and staff. Availability to illicit drugs is also often enhanced by the proximity of some workplaces to nightclubs and other nighttime entertainment venues. Social norms regarding alcohol and illicit drug use are not the only problem. Hospitality workers also report workplace norms that readily facilitate the use and uptake of tobacco smoking. The opportunity to have regular smokers across a shift is often a strong motivator to either take up or continue smoking. In fact, workers reported that having a smoko is often viewed as more acceptable by other workers and their workplace than simply taking a short break to relax without the need for smoking. This social workplace norm around smoking and using smoking as a way to have a break and de-stressing creates a huge barrier for workers who might be trying to quit smoking, while also creating a strong motivation for new or younger workers to take up smoking. In addition to these workplace factors and social influences, there are also a range of individual level factors that can increase the risk for developing alcohol and drug-related problems and dependency. However, again, it's important to remember that there is no single factor that will determine whether or not someone develops an alcohol or drug-related problem. Rather, it can include a range of genetic, personality, psychological and biological factors, along with social and environmental influences. Some of the known individual level risk factors for alcohol and drug-related problems include regularly drinking high levels of alcohol, which is considered to be more than 15 drinks for men per week or 12 drinks per week for women. Binge drinking, which is considered to be consuming 4 to 5 drinks in a 2-hour period. Having a biological family member with alcoholism or a drug addiction. Having a mental health condition such as bipolar disorder, depression or anxiety. Experiencing peer pressure to drink or use drugs, especially as a young adult. Having low self-esteem or self-worth. Experiencing high levels of stress, including work-related stress. And exposure to social cultures, including the workplace, where alcohol and drug use is common and accepted. Certain populations can also be at greater risk for developing problems with alcohol or other drugs. For example, some research has shown that young people, Aboriginal and Torres Strait Islander people, and LGBTQI people are more vulnerable to alcohol and other drug misuse. However, regardless of how many risk factors are present in someone's life, it's important to recognise that help and treatment is possible and available. It's critical to remember that no risk factor is determinative, and your history does not have to determine your future choices and options when it comes to alcohol and drug use.